Hello, my name is Dr. Theresa Larson. I am the founder and president of Movement RX. I became a physical therapist after 4 years of being a Marine Corps officer. I saw a lot of people injured, and I wanted to do something about it. So I decided to get my doctorate in physical therapy, which took a long time, but now I'm able to help people help themselves. So what I want to present to you today is on this concept of downregulation, right? Mental health is coming up so much in our country, and physical ailments, pain, right? It's a common thing, but it's not normal. So what's the problem? People aren't coping well. People aren't moving well. People are in pain, and they aren't getting the information they need of how to solve it, right? When you are in pain, whether it's physical or mental or both, they usually go together, is your body starts to like tense up, right? Your mind starts to race. Your heart rate starts to increase. Your breath becomes very shallow. And the thing about pain is that where the pain actually is, isn't the problem. All right. So what we have to do is like heal you from the inside out. There's a few things you can do. There's breath. We're going to talk about these in a little bit. There's breath work, there's mobility, there's stability, there's retraining movement patterns, and there's sleep. So let's get into the 5 techniques. All right. So the first one is breath work. All right. Breath work. This is one of the most powerful tools that I have learned. So here's the concept of breath work. We breathe really shallow. When we're upregulated, we breathe up in our chest. But the thing is, our lungs, we've got 2 lobes on our left and 3 lobes on our right. We've got a lot of lung space. Lower, the diaphragm basically is a nice little dome that is at the bottom of where the lungs end. And you know where the other dome is? The pelvic floor. But that dome down here and that dome up here, like this is what we're working through with the lungs. So when you breathe in and you breathe deep, you're actually utilizing your diaphragm and your pelvic floor more fully, which then in turn protects your lower back. Here's some techniques that I want you to do. And I'm just going to actually go to my knees for this one. But what I want you to do is place one hand on your chest and one hand on your belly. All right. And this is just relaxation, right? We're going for relaxation. One hand on the chest, one on the belly. So what you're going to want to do is you're going to want to retrain yourself from breathing into just your chest, and you want to breathe lower into your belly. So you're actually utilizing your pelvic floor and diaphragm. So take a nice breath in, close your eyes so you can actually feel what's going on in your body. Take a breath in. It can be through your nose or mouth for this one. And try to fill up that bottom hand first versus your top hand. So notice my bottom hand move first and then my top hand. And then when I breathe out, it's top hand, bottom hand. So it's in, bottom hand, in, top hand, breathe out, exhale, top hand, exhale out, bottom hand. Sometimes laying on your back is super helpful. So as we get into performance breathing, I want to actually have you all lay on your back. But what this is going to do as you do this, it's going to help you just focus, right? You're not moving when you're breathing. You're not lifting or anything like that. You're just having to relax. And notice the breath work, like you want to be very in tune to the sequence, low to high, high to low. Okay. And as you breathe, I want the breath to be a little bit longer. So a good goal is a 5-second inhale and a 5-second exhale, something nice and slow. And as you get better with it, you can start to do 10 seconds, 15 seconds. The next one is mobility. Okay, so mobility is something that we would call it stretching, but it's not stretching anymore, right? Mobility, we get to a more like cellular level of joints, connective tissue, muscles. And mobility is not stretching. Mobility is how those joints and soft tissue are moving. One of the things that you can do is a simple stretch. It's not a stretch, it's a technique, a simple technique where you lay on your back. Okay, this is specifically for the fault of not being able to touch your toes. which directly affects your squat, your deadlift, things like that. You're going to lay on your back, okay, and you're going to grab the outside of your foot, okay, and notice this isn't a stretch technique. This is actually a proprioceptive neural facilitation, a PNF technique. So what I'm doing is I'm actually working on the joint space and the soft tissue around it in my hip joint. So what I'm going to do is press my foot into the air, push into my hand. So what's happening is my joint is being pushed down into the ground, my femur, where the femur sits in the acetabulum. Say that a few times, acetabulum. And hold it for about 6 seconds and then relax and drive my knee towards my armpit. Notice, what is this position? I'm in a squat position, right? Or at the bottom of a lift. Like, this is a position that we go into quite a bit as active people. So push your foot into the air for about 6 seconds and then relax for about 6 to 10 seconds. So that is a mobility technique for the joint. The other one, you can use tools, right? I love balls and things like that. So you place the ball, right? You find your hip joint, so ball and socket. I just do this. I grab my hip joint, place the ball just behind the ball and socket where there's like 6 rotator muscles. And I'm going to straighten my leg that's underneath the ball. And then what I'm going to do is just do a little tack and floss, we call it. So I'm bending and extending here. And what that in turn is going to do is it's going to relieve tension in my glutes. So when I bend over and touch my toes, it's going to be a little bit easier. Let's say I just have discomfort in my upper back. So let's say upper shoulder. I'm going to place the ball, my upper shoulder, and what I'm going to do is just lay there on it and I perform my breath work on it. So I can, if this is just enough, if this is super tender for me, what I'll do is I'll just lay here and perform deep breathing, right? That relaxes my physiology, relaxes the tension in my body. If I want a little bit more intensity, I can lift my hips up and down. I can lift my hips up and take my arm over my head and bring it down, just like this. And my recommendation is with any kind of soft tissue work that you do it a few hours before you train or after, and any kind of joint work with bands and things like that, or PNF, the technique that we just did, you do it pre-training. You need to work on control of joints, control of your body, and stabilizing. So oftentimes, like, stretching is the RX, however, that is not what you need to be doing. So an example of stability would be something like this in a squat. Try to, if you just stand here, toes are pointed forward, point your knees in and try to squeeze your glutes. It's practically impossible to do that. You can get a little bit of contraction. But now, activate your arches, roll your tibias out, roll your hips out, call it external rotation. Now squeeze your butt. Much easier. So this is the position you want to be in, right? This external rotation when you squat. So the appropriate way to stabilize is actually roll your femurs out, get some external rotation in those tibias, activate those arches, and then go down. Instead of going down really fast, go down really slow. If this is a stability exercise, I'm going down for 5 seconds, driving my knees out, holding the bottom position. Usually we're the weakest at the bottom position, and this is where you need to stabilize. I'm controlling my motion, controlling my joints, holding the bottom position for 5 seconds, and then coming up for 5 seconds. So that's a stability exercise. Another example of a control your joints exercise would be like pull-aparts. To stabilize, right, this upper back, I can do simple banded pull-aparts. Feet shoulder width apart, I find my neutral spinal position, and then literally do something like this, right? It's a simple exercise to get those scapula muscles, those wing bones, working in the muscles around it, right? So this leads us into the next topic, which is movement pattern retraining, right? So we just did a little bit of that. However, we're going to put it all together now. So one of the things we like to do is actually retraining movement patterns is make people go slow. So when you squat, right, we want to first stabilize our spine. There's 3 things we want to think about with any movement. Spine. What is our spine doing? It should be neutral in most positions, right? Our butt is gently squeezed. We have a pelvis neutral position. Our ribs are down, not flared, right? We want our ribs down, shoulder blades rolled back, chins tucked. Our spine is in alignment, right? The next thing we want to think about is how we load our joints, right? So we want to load our hips first, a bigger joint, which takes more force. It can take more of the force that goes into the movement versus our knees. Now our knees can do their job. And the third thing to think about is torque, this concept of torque, right? I'm not just driving my knees forward and hips back, right? I'm actually driving my knees out a little bit, but that knee drive out is coming from my hip joint. So spine, the way you move your joints, like how you load your joints, and then torque. 3 things that you want to think about when you're doing movement patterns: squatting, hinging, pushing, pulling, carrying. Okay, so next one is sleep. Let's talk about sleep. One of the most important things that you can do to help yourself heal right away. Issues with fatigue, mood, any kind of mental health issue, any kind of physical ailments. Look at your sleep. You should be sleeping 7 to 9 hours a night, according to the National Sleep Foundation. The way you sleep matters too, making sure that your spine is actually in a good position. So you want to make sure that one of the best ways to decompress the spine is you're laying on your back, right? So this is the first one. And oftentimes I add pillows underneath my knees, but this is the position where it's the least compression on the spine. The other position is on your side, but you want to make sure that you have a pillow underneath your head so your head isn't super flexed or side bent, I should say. It's not side bent one way or the other. It's in line with the rest of my body. I think of posture, right? My spine needs to be lined up. And I also have a pillow between my knees so I don't end up falling into a position like so. So the position of sleep matters. The hours of sleep matter. The room around you when you sleep, it should be cool. The ideal is 66 to 68 degrees Fahrenheit in a room, so pretty cool. And then completely dark to give yourself that chance to be in like a cave where there's no stimulus. So if you have your phone or TV in your room, it should be off and out. And I'd recommend removing your TV from your room. Okay, so I challenge you to take ownership of your health and apply these 5 things to your life now. It doesn't have to be perfect, but you've got to start somewhere.